Hi, I'm Dr. Roger Borbon, and welcome to the Dr. Pure Life Clinic. I'm so excited that you're here. Now, I'm going to be joining you in this room in just a short few minutes. But before I do, I wanted to have a quick conversation with you, really to one, make sure that we can make the best use out of our time together, and two, put you in the know on some things that you may never have heard before, because mostly this conversation is completely absent from all of healthcare, and especially in women's health, and that's where it belongs absolutely the most. So we're going to cover four key components that I think will really help to just take some of your burdens off, take some of the mystery out of why you feel all the things that you've been feeling, and why all the doctors maybe haven't helped you up to this point. And so my goal is that you get the idea of this, not that you have to know every aspect to this, but just so you kind of understand the story. So this will be a kind of a lot of information in a very short period of time, but it's really engineered to help to empower you to take off that heavy load. If you've been given 3, 5, 10, 15, 20 different diagnoses, what you're going to learn in this quick little introduction is that you probably don't have 20 different issues. You probably have one root cause, that what I've seen to be at the foundation of almost all of women's chronic health conditions. And so once we get these things right, you get to reclaim your amazing relationships, energy, and freedom for the life that you truly want. So let's jump in. So so the first thing that we have to know is that if we want to look at what one thing in our body is controlling every single cell, tissue, and organ system in the entire body, what's at the chief command center? Well, we'd have to say it's the brain, right? So we have to start there, because if we understand the brain, then we're going to unlock all your massive potential that you have to get well. So let's jump in real quick with this. So first, if I just kind of plop the brain out of my head here, we would say this is the right side, this is the left side. And without going into too much detail, what we want to understand is they do very different things. Your left brain is your linear thinking, your mechanical things in nature, words, numbers, compartmentalization, and it's your drive, action, motivation. That's left brain. Okay. Your right brain is your creativity, it's your multitasking, your big picture thinking, color, shape, dimension, and the big take home on the right brain is your emotion and consequence. Okay? So if we just take that and we just understand that we were made to be using our full brain. Now, that said, men are left brain dominant and women are right brain dominant. And that's okay. And it's okay if we operate in a margin of difference, just like that. It's if that margin gets too big, this is when we start to have dysfunction. Now, with the left brain, if we had too much left brain activity without enough consequence, then we have action without consequence. So if you're going to cross the street and you didn't have any thought to consequence and you just walk across the street, bad things can happen. So we need that right brain there to introduce consequence enough to where we can look both ways and keep ourselves safe. Now, on the other side of that equation, if the right brain, which is more consequence oriented, becomes, if you're already more dominant, just as a 97% of women are, and if that gets kicked up to be higher, and this can happen through traffic, it can happen through news, it can happen through a physical injury, it can happen through chemical toxicity. There's a lot of ways that can happen. So, but if the right brain becomes more dominant, and as a woman, if you're already prone to being right brain dominant to begin with, and then things just tip a little bit more, then that consequence turns into worry. And worry is okay if it's appropriate for the situation. But if the worry is not appropriate, if there's too much worry given the situation, then that turns into stress, and that turns into anxiety, and that turns into panic, and that turns into all the shades of depression. So this will show up like you're laying in bed and you're dog tired, and the wheels in your mind start moving and you start having conversations with yourself, and this is very right brain type stuff. Now, what's important with the left and the right brain is that your left is your drive, action, motivation, your right is your consequence and emotion. And because when you have to be highly driven, we have to make sure that we have enough digestion taking place so we absorb nutrients. If we go to the flip side of that, when we go high stress, that means we got to take those nutrients and divert them to our arms and legs so that we can run for our life and fight for our life. So we're taking some blood flow and nutrients and our metabolic resources away from our central nervous system, your brain especially, and you're putting it to your muscles of your arms and legs so you can fight for your life or run for your life. So we can look at your visceral system, whether it's your heart, whether it's your lungs, but let's focus on your digestive tract at this point. And if we have more right brain dominance, we're going to have a big like brake effect, like you're going to pump the brakes on your GI system. So when this happens, you slow down digestion and slow down nutrient absorption, and now your cells don't have the raw material it needs to produce energy. So then energy takes a nosedive. And when this nosedive happens, then this is called fatigue. And once this happens for a long period of time, this is called chronic fatigue syndrome. But still, you have to do all the things that you have to do. And so that fatigue syndrome, still requires muscle activation and thinking and all these things, and that builds up waste. And this waste is lactic acid, substance P, bradykinin, these chemicals that your body makes that are pro-inflammatory. And so when your inflammation goes up all over the body, that equals pain. So pain all over the body is called fibromyalgia. So now you have fibromyalgia and chronic fatigue, and that adds more stress. More stress elevates the right brain even more, and now the brakes get put on even more to inhibit digestion. So when digestion motility, the movement, starts to get sluggish, then things sit in the gut. And this is when eating can be painful, like things like heartburn, GERD, acid reflux, or just constipation and bloating. So if there's lots of like gas or abdominal distension and it just doesn't feel good, then that's the constipation where the things are just sitting in your intestines. And as they sit there, they make a great buffet for your viruses, bacteria, and parasites that you have in your body. And so they off gas when they make waste, and that makes more distension and more pain in your gut. And then that distension puts pressure on your gut lining, which we'll talk about in a second. But then your brain says, hey, we got to get rid of this stuff. So it goes from that constipation to overmoving, and that's diarrhea. And if you keep going back and forth between these two things, this is called irritable bowel syndrome. And so if this happens for a very long time, it's very stressful on the tissue of the gut, and it causes like literal like raking and tissue damage on the gut. And then this leads to things like ulcerative colitis, diverticulitis, microscopic colitis, all these bowel issues. And if these continue for a very long time, then you can flip on a genetic switch into things like celiac or Crohn's disease. And then these then go into creating all these other autoimmune conditions. So right now, we just know all these different conditions, from all these gut-based conditions to even stress and anxiety and these kinds of things. They're very brain-based and they're gut-based. Now, what's important is that your GI system, your gut, is responsible for 80% of your immune function. So now more than ever, that's vitally important to have your immune system to be tip top. Well, 80% of it comes from your gut. So if your brain is inhibiting your gut, then you're not having your immune system on your side like you can. The other thing is that also 80% of your brain's neurochemistry is produced in your gut. So if your gut is inhibited and it can't get the chemistry for your brain to do its job, then we have things like brain fog, we have memory issues, and especially it's a decrease with serotonin. So serotonin is the key component that a lot of the anti-anxiety and sleep drugs are based off of. So if your body's not making it, then you'll experience more anxiety, more sleeplessness, difficulty falling asleep. And this creates even a bigger brain imbalance and then further pushes the brakes on the GI system. So you can see this becomes like a cycle, like a snowball effect. Now, the left brain is your rest, digest, feed, and breed system. Your right brain is more with your fight or flight. So if this continues and we know we're having these kind of digestive issues because our rest and digest is being shut off, well, so is our feed and breed. So on the breed side of the equation, we're talking about your gonadal system and your hormone system. So when we consider that, then what we have to keep in mind is that if we're having issues with menstrual cycle regularity or even pain, or maybe you're going through menopause and it's rough, or there's just no intimacy because there's no drive or desire for it, or there's no lubrication for it, and so it's painful. Well, if that system is shut off, that's why. So that system also talks to the endocrine system that's sitting with the brain. So this talks to your adrenals and your thyroid, and all of these hormones work together. So from a hormone side of the equation, what's very common is I'll hear, I'm not eating that much. I started exercising. I'm not losing any weight. I'm frustrated because I see these other people doing these things and they're getting results, but I'm not. As long as this situation is present, you can have a live-in chef and exercise, tip top, and you not only won't get any results, you'll actually be digging yourself in a bigger hole. So you might be surprised at what needs to happen to actually finally shift that equation for you. Whether we're looking at things like hormone dysfunction or colon dysfunction, digestive disrepair, where we're having things like anxiety and brain fog and memory issues and panic attacks, where we're having things where our muscles just have no juice in them, so they're worn out and they're full of chemicals like lactic acid that drive up pain. All of these things, you don't have chronic fatigue syndrome, fibromyalgia, acid reflux, GERD, constipation, diarrhea, irritable bowel, colitis, hormone dysregulation. There aren't 10 different problems going on at the base of it. If this is true for you, which is what we will find out today, if your brain gut connection isn't bridged and balanced, then you will not heal. And this is what I've seen for years and years. And now here's the exciting part. When you do bridge and balance your brain gut connection, it's amazing what happens. And your body right now is designed to perform in that way. Now, we can get off from that cycle for several different reasons. How it got there can be important. If it is there, is vitally important, and that's what we need to check together. Now, I'm going to come in just a moment. I want to make sure that we dissect that out about what is specific to you based on the stuff that you provided for me on the intake form. So I appreciate you filling all that stuff out, because you're going to see that's going to be very valuable in our discussion here. And then also really important in the discussion is I need to know why. Why do you want to get better? Obviously you want to feel better. That's a no-brainer. But I can tell you this. If I can help you, what we do absolutely transforms people's lives, and they are forever a new woman, and you never have to go back there again, ever. To get there, if you're a candidate for this, take some work. Okay, so I'm just going to be real straight with that. And you're here, so I'm pretty sure you're up for it, but I'll be able to kind of clarify what exactly it would take in your situation. But you would need to know why you want to get well. Because if it takes some work and you can keep that very clear, you'll be able to sail through and get back to your amazing relationships, energy, and freedom. So that just gives you the overlay, and also helps to kind of let you unload some of the weight that you've been carrying with all these labels and diagnoses. And I call this modern woman syndrome because women are right brain dominant to begin with. And modern times are relentless. The speed of life here in the US is blinding. So we have always connections with our phones, with social media, with our work and emails, with traffic, and all these kind of things that are there that aren't slowing down. Okay. Now, how you can deal with that can totally change based on the balance of your brain. But today's woman is being taxed all the time because we have all these things that are just part of living. And then if you're a mom, then you've got your kids. If you're a wife, then you've got your spouse. And so all these things are things that you can worry about. And all we need is the scales to tip for a long enough time, and it gets you entrenched in that cycle. Now, I don't want to take your strong right brain, if that's what's going on with you, and depress it. That's what medicine does. We don't want to dumb down your brain. You have a strong right brain. What we want to do is take your left brain and bring that up into balance, and then boom. Now we get the appropriate signaling to the visceral system, and you actually heal. So if that's going on with you, we'll be able to do just a few very simple tests here when I come in, and we'll know exactly where you are. If you're a candidate for what we do, which the resolution for modern woman syndrome is called the Brave Health Method, where we balance your brain, we restore your gut, we align clarity of time, and we get vital movement into your body so that you can enjoy your elevated life. And so if you're a candidate for that, then I'll be able to walk you through exactly in your situation what that would look like. And if you're not, I'll tell you. We will find out if this is a fit for you. And if so, then you can count on being done with all that you've been suffering with, even if it's been for years and even decades, and just leave it in the rearview mirror. So I'll be in just a few moments, and I'm really looking forward to spending some time with you to get you the health you need for the life you truly want. See you soon.